It's like walking onto a starship, and I refer to it as Starship Varian, the manufacturer, but you lay on the bed of the machine, and it moves around you.
The Truebeam is a state-of-the-art linear accelerator, and it's so finely collimated that, so finely tuned that you can have the patients on the table for a much shorter period of time and get a much higher dose of radiation into an area that has disease and spare the normal tissue around it much more efficiently and effectively than you ever could in the past.
And I thought I had symptoms of acid reflux, and there are a couple of different things that can mean, and what kind of drugs you're going to take and all. So when I came out of the endoscopy, and they were pretty sure that I had cancer, some mass here, and it was cancerous, and they already had the follow-up PET scan and ultrasound set up for 4 days later after a holiday weekend, I knew it was pretty serious. I basically have a tumor at the base of my esophagus that grew from within the walls of the esophagus and closed off my esophagus completely. And I was having difficulty swallowing, and that ultimately led to 2 weeks of not being able to do anything other than liquids. So they explained to me that the combination of chemo and radiation were really attacking the tumor directly, locally, and shrinking it. And Dr. Dragnev said, "You may not believe me, but you're going to feel much better immediately. And it'll shrink the tumor enough to allow you to start swallowing semi-solids and then solids." Totally true. Within 2 chemo treatments, I was able to improve my eating and things like mashed potatoes and soft foods. But he was absolutely right. And then the radiation will ultimately shrink the tumor and destroy the cells. While it's happening, there's absolutely nothing. You do not feel anything differently. So, I kind of thought I kind of had never had radiation treatment before, but thought you're going to feel hot or you're going to be blistered or something like that. Not at all. The machine makes some, humming sounds, and when the arms move, it makes some noises. And the technicians are at this point in a control room behind a barrier, so watching and listening. But if you don't have music, or you're in a silent room with humming and buzzing of technology. And I think that with music, it's you kind of dial what you want, even if you didn't have your own music, just to say something soothing or something upbeat and all. I think it makes a big difference. I just think I swear I've fallen asleep a couple of times in that 15 minutes just because it's been kind of, it's music in the background and you're in a fixed position, so take a nap.